Our patient is a 30 years old male and he is complaining of a peri-apical lesion around tooth number 10. He had a root canal case presentation 2 years ago, but the lesion is still there and is getting bigger. His dentist advised him and referred him for a second opinion. The medical history of the patient is irrelevant and he has no pain in the tooth. But tooth number 9 and 11 is still vital and responds to vitality tests. CBCT was taken for more information and diagnosis. And here we see that the lesion around the apex of tooth number 10 and as well involves tooth number 9 and tooth number 11. It's 12 millimeter in diameter. You can see how big is it over here. Also shows around that over here area. What's the differential diagnosis? Peri-apical granuloma. This is our first diagnosis. Our second diagnosis will be amyloblastoma. What is a peri-apical lesion? When a tooth dies, it may become very slightly tender to touch, but otherwise shows little symptoms. The dead tooth may develop low-grade infection around the apex or the root tip, and known as chronic apical periodontitis, which often follows an acute infection that has been inadequately drained and incompletely resolved. What is the pathology? Mostly bacteria, especially anaerobic organisms. What are those? Salmonella species about 15%, Streptococcus malaria about 11%, Streptococcus sanguinis about 11%, Actinomyces about 11%. Also, we find cells. Dental granuloma consists of granulation tissue which is surrounded by a wall of fibrous connective tissue. The plasma cells, lymphocytes, neutrophils, histocytes, and eosinophils found. Also, as well as epithelial cell rest of malaise. What are the causes? Inflammation. Three main characteristics that affect the pulp inflammation. First, pulp can't compensate adequately for the inflammatory reaction, which is limited by the hard walls of the pulp. Inflammation will cause dilation of blood vessels and increase in tissue volume due to transudation of fluid. Second, although the pulp has a lot of vascularization, blood vessels enter through a narrow channel called the apical foramen, and there is no other backup supplies. Edema of the pulp tissue will cause constriction of blood vessels that pass through the apical foramen, so that the pulp tissue is inadequate in defense mechanisms. Edema will cause the blood flow to be interrupted, causing pulp necrosis. Third cause, because of the teeth are on the jaw and there is infection which passes from the apical foramen, the bacteria will spread through the apical foramen to the peri-apical tissue. What are the clinical symptoms? Usually there is no pain in the tooth. Radiographs will indicate the presence of radiolucent area with clear boundaries. Although the radiographic examination is a key diagnostic, the only way to be able to distinguish them accurately is to use microscopic examination. Peri-apical cyst histopathological picture is characterized by the presence of a cavity covered with the epithelial type of non-keratinizing stratified squamous with varying thickness. inflammatory cells, lymphocytes, and plasma cells found in the cyst wall, as well as round eosinophilic globule are found within or outside the plasma cells, resulting in increased synthesis of immunoglobulin. So what is the treatment? Conservative treatment, which all dentists and clinicians they like, and it is the first line of treatment, is to start a root canal treatment. If this is not successful and the lesion exists, then episectomy and curettage to the involved area, and may be as well extraction of the tooth. So what happened to our patient? We did a complete excision and extraction of the tooth. We had a biopsy and sent it to the lab, and the lab came back with granuloma, and this ruled out any malignancy or amyloblastoma. Patient was put on antibiotics, amoxicillin 500 for 7 days, and follow up after 2 weeks, and he was doing okay. This is the end. Thank you.